Hello, in this video I'm going to talk about muscles of the hip. By hip, I mean acetabulo-femoral joint as opposed to sacroiliac or the pubic symphysis. Okay, so starting with our hip adductor muscles. So we have 5 hip adductor muscles that are all located on that medial compartment of the thigh. 3 of them are named adductors, so it's very obvious. But the 4th and 5th do not have the word adductor in their name, but they're still part of the 5 muscles of the adductor group. Okay, so adductor brevis, brevis as in short. So if we look in that picture on the right there, you can see adductor brevis. It's in the most superior part there, then longus, just inferior to that. It's longer, of course. And then magnus is actually very large, much larger than it appears in that picture. So when we get to magnus, we'll see a better picture where brevis and longus are pulled away. Magnus is deep to brevis and longus, which is why we can't see much of magnus. Okay, so adductor brevis, of course, its primary action is hip adduction or adduction of the acetabulo-femoral joint. But because it is more in the anterior part of the joint, it also contributes to flexion of the acetabulo-femoral joint. Then longus, in this picture is a little bit more obscured, but you can see at its origin up at the pelvis, up at the pubic bone, it is just medial to brevis and pectineus. And of course, its primary action is adduction, but just like with brevis, because it's more on the anterior part of the joint, it will also contribute to flexion. Then adductor magnus, that's what's highlighted in green here. In this picture, brevis and longus are pulled away, and so we see magnus deep to that. It's a very large muscle all the way on the medial part of the thigh and the medial part of the humerus. And so it actually wraps around a little bit to the posterior and to the anterior sides, which is why we get in addition to adduction, we also get some flexion and extension of the acetabulo-femoral joint. And that's because it wraps around from the medial direction to both the anterior and posterior sides of the humerus. So we get a little bit of both of those actions there. Okay, and then here's our 4th hip adductor. This is one of the ones that does not have the word adductor in the name, but it's still an adductor. Its primary action is adduction with a slight bit of flexion of the tibiofemoral joint. It's very, very slight compared to our other strong tibiofemoral flexors. This is the only hip adductor that crosses the knee. So we have 5 hip adductor muscles. Gracilis is the only one that crosses the knee. Gracilis is just a long, skinny muscle going right down the medial side of the thigh, crosses the knee, and inserts into the pes anserinus tendon. So if we look at that picture on the bottom, that shows the pes anserinus or pes anserine, pes anserinus tendon. People refer to it in lots of different ways. It also has the nickname the crow's foot because essentially it's a little tendon that has 3 branches. Okay, so let's say here's the pes anserinus tendon. Then we have 3 muscles that are inserting into that pes anserinus tendon. We have a muscle coming from the anterior side of the thigh, that's Sartorius. Then the muscle down the medial side of the thigh, that's Gracilis. And then the muscle coming from the posterior side of the thigh, that's semitendinosus. Okay, so we have one from the anterior, one from the medial, and one from the posterior, all converging into this one tendon like we see in the picture in the bottom of the slide here, all converging into that tendon on the medial side of the tibia. So that's why it has the nickname the crow's foot, is because it's got like that 3 toes of that tendon. So gracilis, that's the middle one. That's the medial muscle coming down to form that middle toe of the crow's foot. Okay, and then our last hip adductor muscle is called pectineus. Of course, its main action is adduction of the acetabulo-femoral joint, but it's also very anterior, so it also flexes the acetabulo-femoral joint. Now, this is a muscle that when someone says they pulled their groin, this is the muscle that's most commonly affected. This is usually the muscle that they're talking about is pectineus. When someone pulls their groin, I mean, that's a very generic thing to call the injury. So that could refer to other types of injuries or other problems there, but most often somebody strained pectineus in that scenario. Okay, moving on to the glutes. So gluteus maximus, maximus as in the largest one, it's all the way the most posterior of our glute muscles, and it's also the most superficial. If you look at the picture, we can see the direction of the fibers, and that should help you predict what its actions would be. When the origin and insertion get closer together as the muscle shortens, then clearly we're going to get extension of the hip. So if we're in flexion, it's going to shorten and pull us into extension. It'll also laterally rotate the hip because of the angle of those fibers and in kind of a lateral direction there. And it also abducts the acetabulofemoral joint. So those more upper fibers that are more on top of the joint, when they shorten, it's going to cause the joint to abduct. Okay, then deep to that, we have gluteus medius and gluteus minimus. So although these are deep to gluteus maximus is a lot more posterior on the joint, whereas gluteus medius and minimus are more on the lateral part of the joint, and minimus even more on the anterior part of the joint. So you could think of gluteus medius as being like deltoid, but of the acetabulofemoral joint, whereas deltoid is on the glenohumeral joint. So gluteus medius is just like deltoid. It has the exact same list of actions that deltoid has. It does the exact same things, but of this ball and socket joint compared to deltoid in the upper extremity. So that's because it has, just like deltoid, has this broad origin with lots of fibers coming off at different angles, all converging into one point that is its insertion at the greater trochanter. Okay, so it's all three parts of the muscle are going to abduct. The anterior portion will flex, the posterior portion will extend, the anterior portion will medially rotate, the posterior will laterally rotate, and then not on this list, the anterior also will horizontally adduct, and the posterior will also horizontally abduct. So I didn't include those on this list here, but it also performs those actions. Okay, so exactly identical to everything that deltoid does. So if you can remember the list of actions for one muscle or the other, you can just remember that they do the exact same actions, but at the two different joints. Then minimus is deep to medius, and essentially is like medius, except it only has the anterior and middle portions. Minimus does not have the posterior portions. So its actions include all of those of the middle and anterior parts of the muscle. So both parts will abduct, and then the anterior portion will also medially rotate and flex, and then also horizontally adduct, which again, I didn't include on this list, but it also performs that action. Okay, so gluteus medius and minimus are all the way on the lateral sort of caps of the hips and do everything that that deltoid does, except minimus doesn't have the posterior fibers or the posterior actions. Gluteus maximus is all the way posterior and angled in a more lateral direction. So it's primarily going to do extension, a little bit of abduction, and lateral rotation. Okay, piriformis is deep to all of these muscles. It's deep to all the gluteal muscles. So it is going from the anterior surface of the sacrum. So it's going from the anterior side, going through that space in the pelvis, and then over the top of the joint onto the top of the greater trochanter. Okay, so primarily it will abduct the acetabulofemoral joint, and it will laterally rotate the acetabulofemoral joint. So it'll rotate to the backside, laterally rotate. So although this is in the gluteal region, it is not considered a gluteal muscle. So only the 3 muscles that say gluteus in them are considered gluteal muscles. This is considered a deep lateral rotator of the hip. So laterally rotates and abducts. So this one can be a pain, literally, because it sits right on top of the sciatic nerve. So the sciatic nerve passes right underneath this muscle. So it's just deep to piriformis. And then the sciatic nerve travels down the whole lower extremity all the way to the foot. So when someone has a hypertonic, or meaning an overactive, tight piriformis, it will put pressure on the sciatic nerve, which causes symptoms of sciatica. So that would be a piriformis entrapment syndrome, and we'll talk about that later on in the course. And not true sciatica. True sciatica would be actual injury or damage to the sciatic nerve. In this case that I'm describing here, this would be impingement of the nerve, where the nerve is actually okay, but it's being pressed on and irritated by a tight piriformis. So that can be corrected with good stretching, massage, exercise, heat therapies, things like that, that will help reduce the hypertonicity of the muscle. It'll stop pressing on piriformis, and then those symptoms are relieved. So those sciatic type symptoms, that would be like numbness, pain, tingling, like a shooting sensation, any of that along the path of the nerve down the posterior lower extremity. And interestingly, in a certain percentage of the population, I don't remember exactly what that percentage is, maybe 10 or 15%, if I remember correctly. In some percentage of the population, the sciatic nerve actually travels right through the center of the belly of piriformis. So in those people, they would be very prone to having a piriformis entrapment syndrome, where piriformis is squeezing and putting pressure on that sciatic nerve. So in some people, they're going to be very prone to that problem, and we'll have to constantly address hypertonicity of piriformis to help prevent or ease those symptoms. Okay, the hamstrings, that is a group of 3 muscles, all in the posterior part of the lower extremity. That includes biceps femoris, semitendinosus, and semimembranosus. So I already mentioned semitendinosus today because that is the muscle that goes from the posterior side to the medial tibia to insert into the pes anserinus tendon, our little crow's foot. So remember our little crow's foot on the medial part of the thigh. The one coming from the posterior side, that is semitendinosus. The one on the medial side, Gracilis. The one on the anterior side, Sartorius, which we'll cover in a minute. So semitendinosus is going to the medial side to the pes anserinus tendon. Semimembranosus is also going to the medial side, but it's deep to semitendinosus, and it's just inserting into the tibia itself, not the tendon. And then biceps femoris, of our 3, that is the only lateral hamstring. Okay, so all 3 of our hamstring muscles all cross the acetabulo-femoral joint. So they all act on both the hip and the knee. So all 3 cross the hip and the knee, so they have action there. So they flex the knee, they flex the tibiofemoral joint. They extend the acetabulo-femoral joint because they're on the posterior side, and they tilt the pelvis posteriorly. Okay, so they originate on the ischial tuberosity. So that's like the big bump in the middle of your butt. And so it's pulling down on the ischial tuberosity. And if it does that, it can tilt the pelvis posteriorly because it's pulling down on the ischial tuberosity. So it can pull down on the ischial tuberosity, that would be tilting the pelvis posteriorly, extend the acetabulo-femoral joint, and flex the tibiofemoral joint. Now, biceps femoris actually has 2 heads. That's why it has that name. One originates at the ischial tuberosity and crosses the hip. The other originates on the shaft of the femur, so it does not act on the hip. But here we're not distinguishing that. So here we're just simply saying biceps femoris coming from the ischial tuberosity and crossing the hip. Okay, the quadriceps muscles. So since I'm only talking about muscles of the hip here, I'm only going to talk about rectus femoris for now. And then when I get to knee and ankle in the next video, then I'll talk about all the quadriceps as a group. So quadriceps means four heads. It's a group of four muscles in the anterior compartment of the thigh. Rectus femoris is the only quadricep that crosses the hip. So that's why I'm singling it out and talking about it here. It's the only one that crosses the hip. Then they all four come together and cross the knee. So rectus femoris is going to both flex the acetabular-femoral joint. It's a primary hip flexor. And it also will extend the tibiofemoral joint along with the other three quadricep muscles. Okay, so it originates on the anterior inferior iliac spine. And then, so it's the only one that crosses the hip. The other three all originate on the femur. And then they're going to come together and they all insert together at the tibial tuberosity. Okay, Sartorius, this is the third muscle of our crow's foot, of our pes anserinus tendon. So it's actually going from the anterior superior iliac spine. That's the prominent bump that you can feel in the front of your hip. And then it's going down and across to the medial side of the knee. Again, it's going to the pes anserinus tendon. So it's going to the medial side of the tibia. And so it forms that anterior toe of our crow's foot. So again, whenever we think about the actions of a muscle, consider what happens when that muscle shortens and the insertion gets closer to its origin. So for Sartorius, for it to shorten and get closer together, what actually happens is you pick up your foot and cross it over your knee. So it's like you form a figure four with your knee. So when you form a figure four with your knee, Sartorius is actually right on top, going from that ASIS to that medial side of the tibia. So if we break down what those actions are when we go from neutral to a figure four with that knee and that hip, if we break that down into its component actions, this is the list we get. A little bit of flexion of the tibiofemoral joint, so it's weak in that flexion compared to the hamstrings. It also flexes the acetabulofemoral joint, so it's one of our hip flexors. It abducts the acetabulofemoral joint and laterally rotates the acetabulofemoral joint. So if we add all of those things up, that equals that sort of figure four position. Okay, psoas major. So it flexes the acetabular-femoral joint. It's one of our primary hip flexors, laterally rotates, and flexes the vertebral column. Okay, so you can see it's originating up on the bodies and transverse processes of the lumbar vertebrae. So of course, if we are bringing, in this case, the origin closer to the insertion, then that would be flexion of the vertebral column. Now let's say the vertebral column stays stationary and we bring the origin towards the insertion. That would be flexion of the acetabulofemoral joint because it does cross the acetabulofemoral down to the lesser trochanter of the femur. But also lateral rotation, which actually I'm going to skip to the next slide so we can see this picture here. This is Iliacus, but psoas coming down from the spine follows the same path that Iliacus does on its more inferior portion. So it's following that same path and going to the medial side of the femur to the lesser trochanter, exactly where Iliacus is going. So that's why I wanted to show this picture. So if you think about it, coming down from the spine and going down to that lesser trochanter, if the muscle shortens, it's going to pull the lesser trochanter forward from the posterior to the anterior side, and that would be lateral rotation. So it's pulling that lesser trochanter forward through the medial side, rotating the femurs in a lateral direction. And so Iliacus has the same exact actions. It's just not flexing the spine because it doesn't attach to the spine. So iliacus is going from the iliac fossa there down to that, through that same path as psoas, down to that same insertion. So it has that same flexion of the acetabular-femoral joint and lateral rotation of the acetabular-femoral joint. And then we can also say it flexes the trunk toward the thigh. That's kind of a tricky thing, because really flexing the trunk towards the thigh is the exact same thing as flexion of the acetabular-femoral joint. It's just that we're stating it in the opposite direction, where we're stating that the origin is going towards the insertion instead of the insertion coming towards the origin. So technically speaking, those two things mean the exact same thing. We're just specifying which attachment is moving. Okay, tensor fascial LATAE, TFL. It's highlighted in this picture there. It's all the way on the lateral part of the hip. So it's very lateral and a little bit anterior. It's kind of towards the anterior side. So again, if you feel for the ASIS, the anterior superior iliac spine, that prominent bump in the front of your hip, it is the muscle belly just posterior to that, coming down just posterior after that ASIS. So because it is anterior and lateral, we get these actions. It flexes the acetabular-femoral joint, abducts the acetabular-femoral joint, and medially rotates the acetabular-femoral joint. So that medial rotation is because of its anterior nature. It's sort of anterior, so it will medially rotate. Okay, so that is all I have for you in this video, and I will see you for the next one. Bye.